Well, thank you, Dr. Poderuca and Dr. Vargas. And I think we all agree that hepatitis B and hepatitis C are interesting, complex, yet viruses we're finally able to get our arms around. But I just want to add a little more excitement to the morning and kind of stir the mix and just mix it up a bit more. So I'm going to throw yet one more virus into the mix, and that's our good old friend to most infectious disease physician, and that's HIV. So I'm going to spend some time talking about HIV and hepatitis C co-infection, touching on a number of different issues, but I want to spend a little more time on the basics, because I'm not going to focus so much on the what, which you got from Dr. Poderuca and Dr. Vargas in many situations, but the why and the how. So with that as a background, I'm just going to go back a little bit on hepatitis C, because it'll later explain how HIV kind of messes things up. So hepatitis C is a positive single-stranded RNA virus with an open reading frame, so it's relatively small in the big scheme of viruses that infect humans. It's a member of the Flaviviridae family, but I also want to spend a little bit of time focusing on what's happened in the past in the history. So until 1989, we didn't even know exactly what it was. It was literally described only a few decades ago by Michael Houghton, who was working for the Chiron Corporation at the time. And in contrast to virtually every other virus that you'll hear talked about at these infectious disease conferences, this virus has no natural cell culture system, meaning we can't play with it in the lab like we can with influenza, Hep B, HIV, everything else. So they couldn't even find an easy way to understand it and watch it replicate and play with it. And then on top of that, the only animal model system outside of us, Homo sapiens, is Pantrochlorides, which is a chimpanzee. So with only being described a few decades ago, no way to actually culture it naturally in the lab, and not a very good small animal model, it is absolutely remarkable what we just heard Dr. Vargas talk about, that we're close to 95+% cures in the mono-infected population. And I'll get to what goes on with HIV in just a minute. So these are two maps of the incidence of hepatitis C on top and HIV in the world. And you can see that we are talking in the tens of millions. There are over 170 million people in the world who are infected with hepatitis C right now, and that's around 37 million in the world with HIV. And if you bring it to the United States, we're a little over 3.5 million in the United States with hepatitis C, and a little over 1 million people in the United States infected with HIV.